I just want to say my name is Chris Blow, and I am the creator and founder and executive director of the Hip Hop Alliance. And we are out there on a mission trying to secure and protect fair wages and fair royalties and strong health and retirement benefits for all of the hip hop and R&B ecosystem. All right, it's a God-centered company, and so it's hiphopalliance.org. Join us. It's free, all right? And I'll hook you up. And these are the breaks. Bring it up, bring it up, bring it up.
Curtis Blow, CrossoverTv.
Yo, it's your boy Chuck Rock, Hip Hop Alliance, hanging out. Beautiful Kendra from the Hip Hop Alliance. Of course, we are here at SUNY Old Westbury, representing, celebrating the culture of hip hop, and all the greats are here, man. Grandmaster Caz and the king of hip hop, Curtis Blow, Kumo D, BLB from the Fearless Four, both alumni of Old Westbury, and we're just glad to be here and to show the diversity of hip hop on an incredible campus in New York City, right? The birthplace of hip hop.
What's the website, Cho, for the Hip Hop Alliance?
hiphopalliance.org.
Yes.
Make sure you join. It's free to join. All right? Yeah.
Yeah.
Yo, with Drill. We want to say a big shout out and happy 22nd anniversary to Crossover TV with Kendra. Yes, sir.
Hey, yours truly, Kendra here. We're live all over the world, www.bronxnet.org. And tell a friend to tell another friend. What I need you to do today, first of all, Happy New Year's, Happy Holidays, Merry Christmas, belated Merry Christmas to everyone. I want you to do this, everybody. Just grab a paper and a pen at home, all right? So once again, we are live all over the world. This is a very important show coming into the new year. And this is so important to me. Now, I should have had my anniversary show today, but I said, this is more important than any one of my shows because we are talking about mental health. We are talking about care for our elderly. We are talking about food insecurities. And we are talking about one particular place that has it all. And if we were ever to talk about wraparound, this would definitely be wraparound services. And we are suffering in a community. And so for the new year, coming into the new year, you can't suffer if you have everything in place, all right? So we're gonna make sure you put things in place today. So I want you to lock your dials right here. Tell a friend to tell another friend to click on right now to Crossover TV. Click on channel 68, all right? So right now, get your paper and your pen, all right? So I'm just gonna say that 10 times. Thank you, Drew Hill. Thank you, Curtis Blow. Thank you, Chubb Rock. I just want to say it is my 23rd anniversary. Drew Hill said 22nd last year. So, we did that already. Now it's 23rd. All right? So I want to do this, everybody. Just remember paper and pen right now. All right. So I want to introduce my guest in the building today. And if I don't say a big shout out to Sylvia Rosada, and she is all Essens Health Care. So I just want to say a big shout out to you. Tell the folks exactly who you are, your title, and
Absolutely. So first of all, Kendra, thank you so much for having us today. Congratulations on your 23rd anniversary of supporting the Bronx community. We are honored to be here. My name again is Sylvia Posada, Senior Vice President for Network Development at Essens Healthcare. And I am here to tell all of you today about all the services and the ability that Essens has to close that gap within access to anything healthcare related.
Thank you so much. And your title?
Sure,
again?
Senior Vice President of Network Development.
All right. Titles are very important because as you know, when I come here, when I come to you, I always come to you with the executive director or someone very close to that position from the top, and we bring everybody, all the staff, because we want to make sure you know who your team will be. And as each person comes today, folks, I want you to recognize that this is your team. So when you were suffering before and you didn't know what to do, I don't know where to go, somebody please, you don't have to worry about it, okay? So let's move forward. This is a new year. How about our resolution to not be the worst borough of bad health for the new year?
Yay for that.
So forget about that 62. It's gone. It's over. All right. So, and this is the organization that's going to make it happen. So I just want to say thank you. And next we have,
My name is
Saj.
Sash Odikari, commonly referred to as Sash. Congratulations on your 23rd anniversary.
Thank you,
Happy to
Sash.
hear that. That's a lot of experience in television,
Thank you.
so looking
Thank you
forward to
so
working
much.
with a professional.
Thank you.
I'm a project manager with Essens Healthcare. I've been working here for about 2 years, and it's been really great to kind of be a part of connecting all these different services and making it possible for Bronx residents to access great care very conveniently. So
Thank you so much for your service.
Sure,
And you know, you guys are connecting the dots all over.
That's the
So
goal.
I love your map. You know, there's a map. See the map behind us, everybody? I love that map. And I love to explain the map, why we wanted this map up, everybody. And let us tell you why.
Sure. So this map is an indicator of all the different sites that we have. We have over 40 locations across the Bronx and a couple in Manhattan. Sylvia can tell you more about the services in those sites, but we have a variety of sites. So we have some that are offering urgent care, primary care, and specialty care, and also specialty sites that do one or either or some combination of. In addition to our partner organization, where we have sites for Bronx Treatment Center, which offers behavioral health and substance abuse services.
I love it. You want to do the next introduction? You're going to be my co-host today, Sash.
Sure.
Go ahead, Sash.
Can do. So I have next to me Fabiola Abreu, Senior Director of New York Reach, which is a partner nonprofit that works with Essens Healthcare. Fabiola, if you want to do a short introduction of your organization.
Yeah, so New York Reach serves the Bronx. We work really closely with Essens Healthcare, and although we're a separate organization, we're very much part of the family. And we support the community. Our biggest program is that we provide groceries and medically tailored meals to people who are food insecure in the Bronx, as well as we provide training. We have a huge program for international medical graduates that come over from overseas, volunteer with us, help get food into people's hands. We have a pantry that operates Monday through Friday, and we hand out food to the community as well.
Can you stop right there? Can
Yes,
you pause?
of course.
Okay, so I'm going to say this one more time, paper and pen. Please go grab one, because all of these services from this, how many sites do you guys have?
Over 40 locations.
All right. So this is what I'm talking about. Like 45, close to about 45, around there?
Sure.
Okay. So I'm telling you, they're ready for all of you. When I say all of you out there, I mean all of you out
right.
there. So one more time, let's talk about the pantries too. You know, you come in, you get all your services. That means they're prepared for every service. Food insecurities, they meet them as well. So how do they qualify for the program where they can get 3 meals a day delivered to their home?
Yeah, so this is a new program in New York State, and you're able to get 3 meals a day, breakfast, lunch, and dinner, delivered to your front door every week. The way to qualify, this is a program specifically for community members who have Medicaid managed care. So if they have Medicaid managed care, what we do is we do an assessment to see if they have a need to receive the food, and we have a criteria that the state identified of what they call enhanced services. So for people that are pregnant or had just had a baby in the last year, it's an automatic qualifier. If someone has a mental health diagnosis or a substance use diagnosis, it's an automatic qualifier to receive food. For people who are constantly going to the ER for their medical conditions and have to have a lot of medical treatment, they will qualify to receive food.
Diabetics?
Yes, so for children, children can also qualify to receive the meals, and for them is a less stringent criteria. So if they have chronic conditions like asthma, diabetes, that will qualify them, or if they are overweight, underweight, or medically fragile. So we are able to deliver the food to people who need it, so that they don't have to worry about the next meal or what's going to be on the table.
I love it. I'm so excited. Can I clap?
Yes.
I asked the studio today, not about my anniversary, but I asked them if they could find something to make a round of applause. But we do have a live studio audience, so we don't really need that. But for this team, I want a round of applause. We're gonna give them one round of applause. Can we do it? Can we do it here in the studio? Okay. You ready?
Yes.
Thank you for what you're doing for the community. And so we really want to get those services going for people. And I know there's some more things that you do for your program. So you want to go a little bit more in depth?
Yeah, so in addition to being able to provide food, we can also connect Bronx residents to other supports like around housing and around transportation. So if they're falling behind on rent, if they need help paying for utilities, or if they're handicapped and may need to do some renovations in their apartments, like lower the cabinets so that they can reach it, or build a ramp. There are programs that we'll be able to connect them with that can support with that, as well as providing transportation for if you need to go to appointments, not just medical appointments, but also to go to court or to go to a housing appointment. We can connect members to those services as well. But we personally provide the food, and it's something that through the leadership of Sylvia, something I feel really, really proud of, because I feel it restores the dignity to people who are
Yes.
food insecure.
Yes.
A lot of times people who are food insecure, there's a stigma to the kind of foods or meals that they're able to get. And then sometimes they wonder, is this something I'm gonna like, or is it something that's culturally appropriate to the kind of foods that I like to eat? We provide really high quality meals. We're culturally appropriate. So for people from Latin America, we have a Latin box. We are getting together a menu for people who are from Ghana and Africa, so
I
that we
love
are
it.
creating staples
I
for
love
the
it.
culture of the people, that so that they can eat what they like to eat and what's part of their diet, but that's also healthy and it's going to make them feel better.
I love this. So I just want to can I give you a phone number?
Oh, thank you. But it's really a team
It's a
effort.
team, of course.
Yes,
I knew she was
yes.
going to say that, but I looked at her, and I just want to say thank you all for making sure that for the food, I do a food drive the last 2 weeks of the month, and you all said to me, no problem, we'll provide for 60 families, that could be 6 to 8 children in a household.
Yeah.
You said, don't worry, we'll make sure that we provide food for every one of your families, no matter how many children, no matter how many
Yes.
people reside. So I want to say thank you, and I salute you all. I give you a huge salute. Thank you so much.
Thank you.
Thank you.
Thank you.
And one more thing, housing. So just being a part. Is there a phone number? People want to know a number they could call. Now, after all of that, we want the phone number. What's the
Yeah.
number that we can call right now?
Yeah, so there is a number that they can call. I think they might be putting it up in the screen in a bit. So you can just call, ask for information. We can do everything over the phone. If you like to talk to somebody in person, you can also come on down to our office on 2424 Creston Avenue in the Bronx. But they can call us, and we do everything on the phone. It takes about anywhere between 15 minutes to 20 minutes to get you all set up.
I love it. I love it. Okay, so let's hear some more, because I want to just come over to Sylvia and say thank you to
Sure.
Sylvia Posada. And I just want to say thank you once again for the work that you're doing. Just taking a look at your map, just knowing how many sites that you have, just knowing that you are changing lives all over the community. And I know it's a community effort, and I'm just looking forward to, you guys came out to our event for autism for Christmas. I'm looking forward to working with you all in April for the April event for autism. But we have a lot of work to do, because there's so many things that we need. You can't get one service without the other service. You can't do this without that. So we have a lot of work to do. So I just wanted to say, Sylvia, if you'd like to talk about what's most important to you for Essens.
Absolutely. So I guess, just to sort of put it into perspective, when you think about the Bronx, it is large, and very sadly so, it's still an underserved community. Population-wise, if you think about the 1.5 million people that live here in the Bronx, it would make it one of the top 10 cities in the U.S. However, being as large as they are, they still have the least amount of not only access to quality health care, but also providers than our neighboring county, Manhattan. So our Bronx community still deals with, higher rates of chronic illness. They have less access to consistent preventive care. The gaps affect these families on a day-to-day basis that are trying to pretty much support themselves, support their elderly parents, support their children, and still take care of their health. And there's a ton that we're here to do. So to put it in a nutshell, when you think of Essens Healthcare, I want you to think of Essens Healthcare as your outpatient provider that pretty much is going to offer you every outpatient service that you can possibly think of. So we offer services from urgent care. We have over 18 locations, and I'll talk a little bit about the acute episodes that we service in the urgent care sites. We also offer primary care. Primary care is pivotal because we are the only ones that offer right now access to a primary care appointment within 48 hours.
Wow, that is phenomenal.
Yes.
Wait, hold on. Let me do that clapping again.
Yes,
That is so
yes, yes.
phenomenal.
And I want every one of you, every Bronx resident, to please feel free to either go on our website, essenhealthcare.com, or call the number on the screen, and you will be able to receive an appointment within 48 hours from when you call us in the Bronx.
Okay, so that number, as you can see, everyone, 718-583-7736, everybody. So it's very, very important that you know, let's just do this today. We don't wait on it. Don't think about it. You know, this is a new year, and that's why for my anniversary, this is my anniversary present. Oh, what do you want to get for your anniversary? A present that we not the worst anymore in the Bronx. You have every service
Right.
brought to you. We're working. You know, when they were talking about loss of food stamps and this and that, I said, oh, I got the hookup, because I know that, you know, Essens would be here. Essence would be the person, the organization that is going. We already ready. You know, they say you have to be ready, right? What the borough president said? Stay ready.
Mm-hmm.
Thank you, Bronx Borough President Vanessa
Yes.
L. Gibson. We got to stay ready, okay? There's a coat drive coming up at the borough. I want you guys to look it up. It's going to be on the 15th of January, and they are giving out coats. So I want you guys to look that up. We're just talking about things that we need in the new year, and it's pretty cold out here, okay? So for everybody, do what you got to do. Make sure you look it up, and it's the Bronx Borough President. She's doing a coat drive on the 15th at Borough Hall. So just go to, you could just look that right up. We Google everything.
Yes.
Okay, so now I want to get back into to Essence, and I want to say thank you so much. We had the opportunity, New York Reach. I want to give out the number for New York Reach, 1-855-697-3224. And I just want to say thank you so much. Just make sure I got this right. It's a 4 and not a 9, right? Is that correct?
Yes.
You don't want to give out the wrong number.
Mm-hmm.
Okay, so that's 1-855-697-3224. And that's New York Reach, everybody. They have a variety of things that they help with. And food eligibility, you need to reach out, call that number, and see if you qualify. Now, I have the blessing of speaking with Sasha's been helping me coordinate today.
That's right.
And I want to give a big shout out to Cheryl. Cheryl is in our building today. I lost my microphone at one point, and we're fixing it, but we're back. And I just want to say thank you so much. Oh, and they bought me this. I don't know if you guys can see this, but it's a humongous fruit platter, and they're keeping me healthy. Look, it's a humongous. I mean, it covers the table. It's huge, and they bought that for me for my. Oh, okay. They want me to show it for my anniversary. Okay, and you guys know me. I'll just take it right back to supportive housing and share it in the community room, because I always think about the children there that I always look out for. And that's what we have to do. And that's why we do this show. So I want to talk about some other things that are very important, Sylvia, because I know we have another guest that Sasha will introduce, because Sasha is my co-host, a little bit like my co-host today. Right, Sasha?
Sure, absolutely.
Thank you, Sasha. And so one more thing that's really, really crucial and important to you.
Yeah, so in addition to providing urgent care and primary care, we also offer specialty care and offer in over 30 specialties. Normally, people in the community of the Bronx have to wait months, 2, 3, 6+ months for any type of specialty appointment. Once they enter the Essens healthcare system, meaning they're part of our primary care, urgent care, or if they just want to use our specialty care system, we're able to expedite access within 2 to 3 weeks or less under a month, depending on the medical need. Again, our dream 25 years ago was to make sure we practice in an area that was needed, not in an area where it was easy to practice. And we have remained very consistent to our mission, our values, And we have been able to, with the help of the community and with a lot of the support of many of the providers and our founder, Dr. Samir Segal, make a lot of what at one point was just a mission and a little room, one office on the concourse, a reality, and be able to expand our services throughout the Bronx.
Wow, I was going to ask you for the history of Essence Health.
Yeah, so I can tell you a little more. Dr. Segal, who is our chief medical officer and founder, started practicing in the Bronx in 1999.
Wow.
So we are on our 26th year.
Wow, that's
yes,
amazing.
Yes, and it was just one office. The office is still one of our primary locations, 2015 Grand Concourse. And, you know, he remained not only committed to the Bronx community, but he also remained very resilient in terms of creating a reality of what his vision was for the Bronx. And that is why today we're able to say that we pretty much have a location within 2 miles of the 35, 40 square miles that is part of the Bronx.
That is such a blessing. It is such a
Yes.
blessing. I salute you guys, and
Thank
I thank you
you.
so much for what you're doing in the community. And come on,
Sure.
Saj.
So as your co-host, I'd like to introduce our next guest. Is Ciara De La Cruz, is the Associate Director of Outreach and Enrollment for our Health Home Program, which she will talk more about. Ciara.
Thank you so much. First of all and foremost, thank you,
welcome,
Kendra.
welcome.
Thank you for the invitation and having us in your house. Congratulations on your anniversary.
Thank you.
It's
thank
amazing
you.
what
God
you're doing
bless
for the
you.
community.
Thank
and
you.
we are trying to join you also sharing the community, but we are also doing for our beloved community as well.
Yes, I love it.
Mm-hmm.
Your story, you have a human aspect of everything that I think of what some of our families go through.
Yes.
I'm an advocate for special needs, and you come in with that piece where you have an amazing part of what you do. So tell us a little, just a little bit about your brother and your story.
Sure. So this is my major motivation of why I am in this field. So close home, one of my brothers is a special need. He has autism and other developmental disabilities, which coming into this country as an immigrant, it was really difficult at the beginning to get those resources because we didn't have guidance. We didn't have that hand holding that families need at the moment, and that guidance that will provide you the information in where to go, where to knock on doors, and what resources actually are there. Sometimes, even though we are here for longest in this living in the Bronx, we might not know, the families out there not know the resources that are available. They are blind. It's just like looking around for services that are available for them, but they don't know where to go.
Exactly.
So it was really difficult for us to get assistance for my brother, and we were looking on the clinical side at the beginning because first of all is getting this diagnosis. What actually our family, our son, our brother, our cousin, what is happening with our family? We don't know what is the actual diagnosis. Getting the right provider, getting the right specialist, getting the right coordination service at the moment, it was so needed, and we were blind. We didn't know where to go. So what actually Essens now has, it would be at the moment for my family, the support that my brother needed at that time would come earlier and would support a little bit earlier, and a release for my mom carrying with all of this heavy weight of not knowing where to go. It was really difficult to get the support. It was really difficult to understand what was happening with my brother. First getting the diagnosis, then what is the next step? It was really difficult, like where we should go. And we were knocking on all the districts, on schools. It was extremely challenging. And we were just calling in different resources, but nobody stayed with us to give us the guidance. And this is why I'm so proud to be part of an organization that once you knock at one of the doors for us, we're going to make sure that you receive all of the resources. And in each clinic that we are positioned, each neighborhood, we can give you this guidance.
Can you say knock on the door one more time? Knock on the door. Say knock on the door. And what's going to happen? Essens is going to open it.
Open every door that is needed for that
every door.
family.
It happened for you, right?
Yes.
In your family, right?
You just have to
Alright.
take one step, and Essen will take care of the rest.
Yes.
I love it. That's all we
Excellent.
need, everybody. So let's give out the number one more time that where people can contact you all.
Sure, we can use the Essen Healthcare number. Should be up on your screen right now. And also, Ciara has more to say about health home services. So part of what she highlighted was the kind of care that her brother could have received. So it includes things like having a care coordinator assigned to you, which is
Yes.
really a representative for you for hospitals, for clinics, for different kinds of social services that you require. They will kind of be like your representative
Yes.
to go in and maybe go to a shelter if you're at a shelter and need support, and reach out to you and bring the care to you. So that's their job.
It's truly a blessing.
Yeah. The beauty of health home is that once you meet the eligibility criteria, it is a long term.
What is health home?
Health home is a combination of services, and I like to present it as a bridge between patient's need to the patient's resources. So we work with every resources that is available, the government has available for all of the community. It's based on eligibility. The first thing that we need to know is that if the patient is eligible for Medicaid. And let's pause on that, because if the patient is eligible for Medicaid, our organization also will support the members to apply for Medicaid. We do have those resources. We do have staff that will go to patients' home, or will have the patients come into one of the nearest offices that we are located at to support this client, this potential patient, and apply for Medicaid. And then once it is active,
Including all the paperwork
Yes.
needed.
I love it. I
Mm-hmm.
love this. And then the process just keeps going.
Yes. So we have coordination services for children's, starting in 5 years old on to 21, and then starting in 21 and older, then we start with our adult services. So once they have eligibility for Medicaid, we also have to ensure that they meet the criteria for chronic conditions. So health home is really predetermined by Department of Health, and it is a services that is paid by Medicaid for these individuals. And also we have to ensure that they meet the eligibility criteria when it comes to their appropriateness. We have to ensure that we receive the information from the family, if they are street homeless, if they are located right now in a shelter, if they already apply for housing and they need guidance, when they need support connected with the social work that is working with their cases. I know earlier on we also work closely with Fabiola, which is part of the NY Reach, ensuring that if the patient does not have SNAP, then we connect them with NY Reach to receive this delivery for the patients that qualified as well. As you see, we are an organization that we work as a comprehensive center for the community. Everything is aligned, and we ensure that any person that knocking our doors receive the resources.
I love it. I love it. And so should people worry if they don't have citizenship? If, should they worry that they can't receive that help? Can they still knock on the door and you open it?
If the patient is eligible for Medicaid, it doesn't matter if the eligibility for immigration status.
Thank you. That's what I needed to hear. So I didn't want to say it, so I needed you to say it.
Yes.
Thank you.
Being as connected and as multifaceted as we are, we do try to pick up people that even if we can't take into our door, we'll try to pass it on to someone
Nonprofit
in our organization or another nonprofit organization
I
to
love it.
service that member.
And your affiliation with other organizations. I love the way that you network and how you move. I honestly do. I just want to say thank you for that once again.
Absolutely.
Okay, and I love your story. Thank you for sharing with me. Your brother's 18, and it's at 18 things begin to change again.
Yes.
Guardianship, the 17A comes about, and some more services. But we're going to touch bases. We're going to connect, and we're going to work for a group, a population. Psychosocial, psychologicals are very important, or we can't get through to the guardianship.
Yes.
And 17A, which starts at age 18. So we still have some work to do, and I do have I don't know if you have lawyers, but we do have some lawyers that help with the 17A. So I'll put you in touch if you don't, and then we'll just keep networking. And in April, we're going to bring a range of services together. And so it's like a marriage. It's like
Yes.
people don't understand. It's like, I do. It's a marriage. And so thank you all for creating this marriage so that we can come together and do so much. We can open a lot of doors for a lot of people, and that door will remain open. Because nobody's going to want to close the door with all of these services in one place. All right. So you want to talk about this? Who wants to talk about the slideshow?
Sure, I can help out if needed. So if I don't know if we could back up a little bit so we could talk about urgent care right before it. Urgent care is super critical because it is pretty much the opportunity for people to avoid having to sit in the emergency room. Most of the time when we get sick, it's not detrimental to our lives, right? Knock on wood. However, so if we have a very severe headache, if we have fever, if we have, just a basic cold, allergies, there are a slew of situations or acute episodes that if you go to our website and you look up urgent care near me, we have over 21 locations. You can either schedule a virtual visit and talk to a physician over the phone, or you can go to the location and you will be able to get seen. And pretty much, again, these are things that are very everyday, we can resolve without you having to sit in the ER room. A huge percentage of our community spends a great deal of time in the emergency room because they don't know that this is available. And also because they think they're going to get treated faster, and that's actually a myth. They're not. When you go into the emergency room, you get fast-tracked depending on the severity of what you have. So if you come in with a cold, but somebody just came in and it came from a car crash, God forbid, or anything much more serious, even if you got there first, you go right to the back of the line.
Wow.
The other thing that people don't realize is that when you're sitting in the emergency room, there are a lot of people that are not well and obviously naturally spreading germs. So you are just a magnet to all of it. So urgent care on demand or visiting one of our locations, it's your guide and your ultimate solution to getting care right away.
And how many urgent cares do you have?
We have over 21 locations.
Wow. In the Bronx?
And in the Bronx,
Wow.
all in the Bronx. So all within 2 miles from where every Bronx resident resides.
Well, you have this whole thing covered.
Yes.
Okay. So, where are we at now?
We moved on to pediatrics and the specialty, all of the specialties and where we offer services.
Cardiovascular. Wait, stop. Cardiovascular is like huge. You guys talk about cardiovascular, please.
Our cardiovascular program is one of the largest in terms of number of providers that we have on staff, and also in the number of procedures and the number of services that we can provide. And again, no, you do not wait more than 2 to 3 weeks, and everything is based on medical necessity or severity.
Did you say 2 to 3 weeks?
Yes.
That's it?
Yes.
You know how many
Yes.
months I have? Wow, I don't want to tell you my hospitals, like procedures for my son, and it's like, it's downtown.
Right,
And
right,
it's,
right.
it's like a wait period.
It is,
in the
and
city.
it's no
It's in the
fault
city.
of the hospitals. I mean, unfortunately, the way that the healthcare system, works within the hospitals, they're bombarded and they're all doing the best we can. But that's why we're here, right?
That's right.
That is why we're here, to provide that relief, to get you seen earlier on, to get you access to a specialist earlier than 6 months, because the earliest you get to see a provider, the sooner that you can take care of whatever it is that's happening. And obviously the probabilities of you walking away healthier or getting a solution, a medical solution, is much, much faster.
Well, I commend you. I'm going to do this throughout the whole show today, so just look out for that, and just receive it. Receive it, okay?
I'll receive it on behalf of our entire
team.
Provider community, our
Yes.
administrative
Yes.
team,
Yes.
and everyone at Essens Healthcare that makes it happen
Yes.
every day.
Thank you. Saj, come on, Saj.
Sure. So I have next to me is Cheryl Simmons Oliver. She's our consultant for connecting with the community, leaders in the community, and government.
She made this happen, so
She made this happen.
she made
yeah.
this happen, so we're giving her a round of applause.
Well, I thank you very much. Happy anniversary.
Thank you.
And specifically, I'd like to congratulate you for your show
Thank
and your
you.
commitment and dedication
Thank
to
you.
ensuring
Thank
that the community is aware of what is happening
Yes.
right within the 44.4 square miles of the Bronx.
Right now, what's happening
Right
right
now,
this immediate
right
second.
now.
Right
so,
now.
as you have mentioned, the number that they had allocated to us, New York State, 62.
Yes, 62.
Well, in 26, we can eradicate that number.
yes.
We can
Clap to
eradicate
that
that
one. Hold
number.
on.
And
Yes.
the reason we can eradicate that number is Essence is right there.
Yes.
They're right in our backyard. Dr. Segal selected the Bronx. He didn't have to select the Bronx. He could have said, I want to go to Manhattan, or I'd love to go elsewhere, but he selected the Bronx. And because we have this service here, we now have the opportunity to begin the true path towards recovery.
I love it.
You've heard through our senior VP of the array of services. They're real services, all right? They have exceptional doctors. They don't have, oh, I don't have any place to go, so no. They have exceptional doctors. The women's health is over the top. The doctor that is there, the doctors that are there are the same doctors that are downtown. Trust me, I know. Okay?
I love it.
They're the
I love
same
it.
identical skill set. So we can actually get the message out to our community that when you think of Essence, think of the highest quality of healthcare delivered right in your backyard.
In the Bronx.
And understand that it goes through a complete array of services. So if you're in the area of substance and you want to, Sylvia will tell you about that. If you are suffering with mental illness and you're pregnant, she can tell you about that. If you decide that I really want to go and find out why my heart flutters, she'll tell you about that.
I love
So
it.
we want to thank you for inviting us here on your show. And we want you to know that you have our complete support. And with our support, not only comes with those who are here in the audience,
Thank you.
but the full, complete
Thank
team
you.
that Dr. Segal has put together. All right?
So we got to make that happen. I'm expecting
Absolutely.
somebody
Absolutely.
to land on a helicopter in the studio. Oh, amen, amen,
Amen.
amen,
Amen.
All right, that's what I'm expecting next from this group.
Listen,
because
it's
that's,
coming.
You guys are touching lives, saving, changing lives, and we can change the 62 that they talk about us.
right.
We can change it.
But
You
it
have
requires a community.
Yeah,
and
it
that's
does.
why we're
But
here.
you have the services in place, and all we have to do is pick up the phone.
That's right.
What's that
Yes.
phone number one more time? All we need to do, this is 2026, is pick up the phone.
Pick up the phone.
Pick up the phone. You know, you feel like you can't even leave your house. They have services where you can have a visit at your house, all right? Just pick up the phone. Things are changing. Pick up the phone, dial 718-583-7736 today. You know, we have things to do.
And it does not matter your status. Pick up the phone, make the phone call. Everything is confidential. And so as a result, it doesn't really matter what your status is. It's what your need is. For yourself, for your children, for your entire family. Think of your need. And when you think of your healthcare need, think of Essence.
Yes, I love it. And I want to thank the senior VP. I want to thank you, Saj. Saj, thank you so much for co-hosting
been a
with me
pleasure.
today.
Thank you so
He's
much
been
for having
very
us.
patient with me today. We spoke on the phone a couple of times today.
That's right.
On the phone and in present. So I want to say thank you so much. And not only that, we have more folks in the studio today. And I said, you know, you can bring your whole crew up here because, you know, everybody provides this specialty or that specialty or this service.
That's right.
And I think I said to you, my concern is mental health and maternal health because, I mean, we hear about the doulas and everything going on now. But when people have a baby and postpartum depression sets in, that's where I'm not seeing they're not connecting the dots. They're like, if the people tell them at the hospital, no, I don't want this baby. No, don't bring the baby. I don't want to feed the baby. I'm scared of this baby. You know, I don't want to hold the baby right now. They don't connect them with someone to come into the home, discharge them with services.
Right.
Like, people are not being treated correctly. And they're scared to say, oh, I don't want to hold my baby. I don't want them to touch me. You know, they're scared to say what's happening because they think ACS is going to take their children. So what we have to do is let them know that they are protected and services can be obtained.
Yes.
It's obtainable.
That's right.
You know, they don't have to be feeling like they can't get a service because they're scared to tell. They're scared that they're going to have their child taken away.
And the most important thing that they have to remember is they don't have to wait. So if you have a problem, pick up the phone, call the number, and help is on its way.
Yes.
That's the message. Help is on its way.
Amen.
So to reduce that level of anxiety and fear that one has, they need to know you have a support system. I have a very simple process. So I can say, let you can go out, because guess what? If you fall back, Essence is standing right there
I
to
love
catch
it.
you.
Amen.
All right?
I
They're
love it.
standing right there to catch you. And they are a phenomenal, I am being very boastful on their behalf, team.
I love it.
Across the board. The same quality of service at every single site you can expect. So there's no reason to say, well, oh, but I don't know when. Just walk in and just say it.
Care. I'm going to visit the sites. I'm going to
Yes.
come out and spend some time with you guys.
Please.
I know we'll be back together in April. You
love
came
to.
out to the Christmas drive. You supported us. But I'm definitely going to, it was packed, right? The
Yes.
Christmas drive was packed. And
Yes,
that's
you-
families
yes,
that,
it was.
it was packed, right?
It was packed.
And it's a free Christmas party. And what I brought to the event a couple of years back was services. I said, if we're going to bring, for the differently able, there should be providers in place, because you need a care manager. You need, a Medicaid service. It used to be Medicaid service provider. So you need certain people to get in place just to get the OPWDD status. And why shouldn't we have the same services after school? My son gets piano lessons. At one point he was getting piano lessons.
Right.
And all kind of services after school, a gym, or this, or that. And, OPWDD pays for that.
Right.
So why don't we get our families in line to get what's going to help them? Why don't we get the treatments, the doctor's appointments, make things easier so they're obtainable? That's why people don't show up. And if you don't show up, you're not going to get it.
Well, the doors are open.
Right.
The
Exactly.
doors are absolutely
the doors
open.
are open. Please knock. Like the message today is to knock.
Yes.
In 2026, and what's going to happen when I'm knocking? What's
door
going to
will
happen?
open. The door is going to
The door is
open.
going to open, right?
it
is.
All right, that's what I'm talking about. And so every time you think about Essence, just think about the knock and the door will open. Can you put that number up on the screen one more time?
Please.
We are not going to be the knock. The 62 thing is out the door in 2026. I mean, when I found this, I didn't know what else to. I don't know what else to say. This is no excuse now.
Right.
It has to connect, because every service is here. And I just want you to give me a roundup of services. Do we have one more guest?
No.
Okay, so let me just make sure we round up the services that are most important, as our senior VP
That's right.
Sylvia
That's
spoke about earlier, and just give me that wrap up, the roundup.
Absolutely. So remember, we do urgent care visits, virtual or in person, or literally just walk into our urgent care locations, 21 in throughout the Bronx. We have over 40 primary care locations. Call or go on our website, and you can be seen within 48 hours. If you need something urgent, again, you go back to the urgent care. Specialties, we offer services in over 30 specialties, much sooner than if you had to wait anywhere outside of Essence and within the Bronx. Normally, average wait time is months, 3 to 6 months to be exact. With us, it could be 2 to 3 weeks. Also, we provide house call services. We literally bring the doctor to your home, not only in the Bronx, but also throughout all 5 boroughs, the tri-state area. And with Ciara, who was here before, is pretty much helping you coordinate all of these services that you can have access to. And last but not least, NY Reach is here to support you with nutrition and to help you get screened and make sure that you're eligible to get home delivered tailored meals.
I love it. I just love it. Okay, and just think about this: 3 times a day. I mean, there's no reason. Just your program alone. Just think about what you're doing for so many. About how many you think right now you're servicing right now at this
Well, right
given
now we
moment?
touch about a little bit over 250,000 patients
Wow.
comprehensively, our entire health system.
Wow.
Yes.
And just think, 3 times a day, a meal can be delivered to one of your patients for 3 times a day, breakfast, lunch, and dinner during the times of this crazy insecurity time that
yes.
people are
Oh,
facing.
yes.
I mean, it's sufferation. And the one reason, I'm so glad that I know you all. The one reason that I started my food drive is because I just could not take it. Seeing kids in supportive housing, not having the food that they needed. Breakfast, how can you learn if you're hungry? How can you learn if you're hungry? And it's not just for the children, but you have to feed the family. If you don't take care of the
Hardworking
entire
parents,
family,
yes.
hardworking. Say that again.
The hardworking parents that
Or-
try to make it happen for their kids, so they can do well in school. Grandparents that support the parents after school. It impacts the entire family.
People that are depressed. I mean, sometimes you can't even get out to get a meal if you're depressed and you haven't left the house in a week. I remember when I went through post-traumatic stress disorder through domestic violence. I remember it could be a week out where everybody knows my burgundy robe. I save it, you know, I save it. I started this food drive to say I'm not just, don't think because I'm on TV. We all go through moments.
I agree.
So I just want people to stop thinking that, oh no, if I do mental health, that no, I had 2 therapists at one. I mean, I needed 2 therapy sessions a week because of that domestic violence period that I went through in my life. I needed 2 therapists. It was so bad that I needed. It was because you can only get an hour a week of counseling. So I needed to go to Safe Horizon for 1 hour, and then I went through. And it took me quite a bit of time to get through that period. I share these stories on TV because I don't want people to think that. Don't be ashamed of it.
Absolutely not.
Don't be ashamed of this. Most people, these therapists don't even remember. They don't know nobody you know. Okay,
They
Saj,
don't.
I just met you, right? You don't know me, Saj. Saj, you don't even know me, right? Like that, right?
Think
Not
of
yet.
it
I'm just saying.
as a friend that is professionally trained
Exactly.
to help you resolve whatever challenges you're having. And also as an investment in yourself.
Yes.
You're doing it because of
asset.
yourself, and you're doing it if you have little kids, so you can show them how to get ahead and how to look for resources and to look for help. And the end of the rainbow is it's really where you are able to rejoice in what's going
I
to
love
bring
it.
ahead of that.
I love it.
Yes.
Sylvia is not coming to my house. I'm just letting you know. I'm just saying, you ain't gonna see. I'm telling, just imagine I'm telling Sylvia all my business.
Right.
You think Sylvia's gonna come to my house and hang out with my friends over there? No. So I'm just saying, they're not gonna know anybody. They're not talking to anybody you know. So we have to get rid of this stigma.
Everything is
This stigma,
confidential,
this
yes.
stigma has to leave. So let's start getting ourselves together. It's 2026.
Yes.
Come on now. We got the new year. We're going to lose some weight. I'm about to drop 10 pounds. All right, but we're going to do all these things. But mental health, if you don't have peace in your mind,
Yes.
listen, you can't function. You can't make it. When I went into the shelter, domestic violence shelter, I said, I can leave my truck. I left my hospital job. And I said, I'm good. Because as long as I have a peace of mind,
Yes.
I can make it. You lose your mind and find out if you get it back, how hard it is to get it back. Once you're out there in the street and you're walking around and you're talking to yourself. So I just want people, I'm just hitting it over the head.
Yes.
Mental health, mental
Very
maternal
important.
health. It's very important because it's not wrapping around. Things are not happening.
And so many issues can be experienced at the same time. You can go through
Yes.
a maternal issue and
Thank
have a
you,
mental health
Saj.
crisis.
At the same
You need
time.
those, multiple kind of services collaborating, cooperating for you, and
Thank
that's
you,
what we
Saj.
hope to bring. So.
Thank you, Saj. So
You know,
that's important.
one more thing as you're talking about this, Kendra. 2 very important things that I want our entire Bronx community to know. Number 1, our women's health department takes walk-ins.
Yes.
Thank
So
you.
once
Yes.
you go on our website and you see where there's a location, you don't need to call, you don't need to
walk in.
schedule an appointment. You can literally walk in. And I say this because I know that for us women, most of the time we take care of the entire family and we forget to take care of us.
ourselves.
Unless we're feeling something physically, we don't make that choice, we don't make that decision. But unfortunately, by the time we physically feel something, it's always very late. So that's why we need to make sure we do this. Or if you're walking down the street anywhere throughout the Bronx and you see an Essens location provides women's health services in over 12 locations, literally just walk in.
I love it.
That's number one. The other piece, again, to being very open to looking for help and support through our affiliate organization, the Bronx Treatment Center. We also offer behavioral health, mental health, that you get to speak to either a psychiatrist, a therapist, a social worker, and it's now available. I don't know if we all remember back, like I want to say 2 years ago, and even now, you wouldn't even be given a slight incline of when you were going to get a
It's still
behavioral
happening.
health
It's still
appointment.
the same. It's the
Well,
same.
please call us.
Yes.
Please
just
call
What's the
us.
number one more time? It's still the same. That's why I'm
For
talking
the
about
Bronx
this.
Treatment Center, there goes the number. And we'll be happy to schedule your appointment. We also accommodated, so because we know people work after work, so the first appointment may be during the day, but from there on, you coordinate with whoever you're assigned so that you could have late appointments and we can work within your
Is that
schedule.
in person or on the
The
phone?
first
Virtual.
one in person, the rest could be virtual.
And that would be after what time for the virtuals, the latest?
Once we go on the website, I will tell you for sure. I don't have the times.
Okay, we'll get back
But
to
I
you.
could tell you that we're servicing about 10,000 patients on a monthly basis.
Oh my
Anxiety,
goodness.
depression,
Yes.
all of
Yes.
that.
And I hit this over the head the most out of
Right.
everything, Sylvia. I'm telling you, I hit this because I see it. And I live in my community, and it saddens me. I'm almost in tears when I'm looking at, and I'm saying, oh my God. I pray all the time as I'm walking and going and coming in and out. I pray
Think
for people.
holistic, comprehensive
Yes.
delivery of service.
Yes.
Holistic, comprehensive
Yes.
delivery of service.
I love it.
And make the call.
Make the call.
Make the call.
718-583-7736. So right now, I'm just going to say it up. 718-583-7736, everybody. Please make that call. And what's the time that they can call? 9 to 5 or?
9 to 8 o'clock.
9 to 8. Even right now,
Yes.
they're
So make
open
the
right
call.
now. So 9 to 8. And I really want us to touch mental health because it touches every person. I don't care if you're working, a professional.
Right.
I don't care if you're beautiful.
Doesn't matter.
I don't care if you look different. I don't care who you are. It affects us all. We don't escape it. And once I said to you before, remember this, do not sacrifice your peace. And therapeutic sessions are very important.
Yes.
And in our communities, we frown upon that. We have to do this. And I want to thank you. And I want to thank you for all the services that you provide that wrap around that. So just imagine what's going to wrap around that. So start thinking wrap around. Like, you get a cut and then, the gauze just goes around it because we're wrapping around it. Everything is, they're treating this, get antibiotics on it, treat it, now wrap around it so that you can get everything that comes with it.
Yes.
And so as we talked about, Sierra's brother.
Yes.
And, so now let's wrap around. Let's make sure that now at 18, now we need to start services all over again. Wrap around it,
Right.
okay?
Yes.
So this is, let's say it one more time. I want to give a big round of applause to Essens Health. We're going to go to a slideshows just for a minute. I don't know how much more of this you had. Whatever you think is the most important. But I just want you guys to remember, call the number. It's on the screen. And I did this show. It was my first show back. It means so much to me. So I'm going to let our senior VP, Essens Health, I want to thank you so much, Sylvia Posada, for joining us today. And
Thank you.
Come on,
Thank you
Sylvia.
again. Thank you for having us. So one more area that it's very critical. We have 2 beautiful pediatric locations that service children from 0 till 19. Obviously, once you're 19, then you can go see one of our primary care physicians. But we provide all kinds of services, sick visits, annual wellness visits. We provide all the needed vaccinations, physicals. Now that, they're getting ready in a few months, we'll get ready for summer camp. And even after summer camp, at the beginning of the year, they need physicals. it is very astonishing to us, as I work with our provider team, how we see at the end of the year when we work through the different health plans, and they tell us, oh, you have 100 or so patients that have not received all the appropriate vaccinations. And, I just really want to call out to all the patients the importance of receiving these vaccinations. It prevents kids from getting things like measles and chickenpox and polio and so many other conditions that we don't know about because we have been taking the vaccines. But the minute you stop, your kids are pretty much at risk. So visit your provider. You can also discuss different belief systems that you may have. They may also be able to give you medical advice or other precautionary measures that you need to take. But ultimately, come and see us, your children. Bring them to us and to our providers, and we'll make sure we take care of them as well.
And more on the children, going back to Health Home, we also have Health Home services for children that we're introducing in 2026. So we're looking forward to having care coordinators assigned to your children who will be able to manage their care, speak with their doctor, liaison for them with the healthcare system that they're
I love it. Now, I'm
with.
going to ask you to do me a favor. Okay. I'm an advocate for special needs, and we talk about the differently able. Now, this is a huge problem for us. So now our children are 21. So now 19, they stop, right? In some places, 18. Now we have these autistic kids that watch Elmo, and their grade level is the first grade. And now they're being taken away from the kiddie section that they know, and now they're being placed with adults in clinics. We have to do something better than that, right? So we have to see how we can bridge it, that the doctors that are pediatric can go a little bit further. School goes to, now school is extended to age 22 for our children. So now we kind of got to get the doctor's office to go at least, the pediatricians to go to at least 22 because the children come away from school at 22 from autism and different whatever that may be, look like for differently able. So I'm asking you guys to look at that and see what we can do working together so that our children can be in a friendly environment, or have clinics that are for the differently able, that are ped specialty, that still look like peds.
Absolutely.
Even if because our kids go up to, they can stay on first grade level forever. All right? So we have to be able to treat them and make them feel like who they are, right? So I need you guys to think about that.
So those are policy and regulatory changes. And remember, I said Essence is full service. So we do work with our elected officials, and it would be a wonderful issue to
We have a lot of things.
discussion.
I have 3
with them.
policy changes, and we'll talk about them
We'll
another
talk
day.
about them.
I'm working on them. I wrote them. All right.
Yes.
This is great. We're going to close out. We have to close out now. But we want to give out the number for Essence, and we want to say thank you so much. I love you guys. Essence Healthcare. I want to thank New York Reach for that information. The number, once again, is 718-294-6200. And that is for
House calls.
house calls. And then we have another number.
Behavioral health.
And this is?
I could read it for you.
Oh,
if
yes.
you want. So our behavioral health number is 646-350-1633. You can call to book an appointment in 48 hours. We also have free home delivered meals courtesy of New York Reach, 855-697-3224. Again, that's 855-697-3224 for home delivered meals. And we also have, once again, house calls where doctors will visit your home. That is available at 718-294-6200. And lastly, our main number for primary care and all the different services that Sylvia has spoken about, 718-583-7736.
Okay, I want to thank everybody. We'll see you next week. Everybody, lock your dials. I have New Jack City next week, so look out. Celebrity guest, Gerald G. Money. You remember the big movie, New Jack City with Ice-T. I have folks coming through this building, so lock your dials, everybody. Gerald G. Money will be in the building, so lock your dials.